I'm in derm referral, so I am seeing the worst of the worst, right? And they've already been struggling for months before they get the referral to us. So yeah, we're seeing great response to the worst of the worst. But if GPs were using this, you nip things in the bud, it's going to be magic.
Hey, everyone. Welcome back to VetFolio Voice. In this episode, I was joined by Jenny Tate to talk about the role of light therapy and more specifically fluorescent light therapy in managing different dermatologic conditions. Just a forewarning, if you had any reservations about incorporating fluorescent light therapy into your practice, Jenny really left little doubt as far as the benefits this therapy can provide for our patients. She explained the mechanism of action when it comes to light therapy. I mean, of course, we talked about red light and blue light therapy, and then we kind of compared and contrasted those with fluorescent light therapy that encompasses the whole spectrum of colors and why that matters. We also discussed how light therapy can help enhance the body's natural healing processes and the growing body of research that's continuing to support its use. Probably most striking for me was data illustrating the impact of light therapy in reducing the duration of antibiotics when treating conditions like deep pyoderma, which historically has required prolonged courses of antibiotics. And of course, this discussion would not be complete without talking about antibiotic stewardship, which is a huge topic of conversation right now. And I love hearing about anything we can do to enhance healing while maintaining antibiotic efficacy wherever possible. Now, regardless of the benefits of fluorescent light therapy, it has to fit into a clinic model. So we definitely got into that discussion too. And Jenny illustrated how a therapy like this can be both clinically rewarding due to improved patient outcomes, empowering to technicians and staff members, and financially beneficial in almost any practice environment. So if you've been curious about light therapy, or if you're already using it and you want to know more, this was really a great conversation. Let me tell you about Jenny. We'll jump into it. Jenny graduated as an animal health technician in 1986 and started her career in general practice before moving to the Ontario Veterinary College, where she spent 25 years. She found her passion for dermatology when joining the OVC Dermatology service in 2000. After retiring briefly, Jenny returned to part-time referral work at the Vader Clinic in Morriston, Ontario. Jenny was the fourth person in Canada to achieve RVT certification and remains the only veterinary technician specialist in dermatology nationwide. Jenny also serves on the executive committee for the Canadian Academy of Veterinary Dermatology and is an author and international speaker in her area of expertise. All right, let's talk about fluorescent light therapy.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serolaner Moxidectin and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serolaner belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicatRioDVM.com for full prescribing information.
Well, I'm really excited. Jenny, thank you so much for joining me. VTS in dermatology, the only one in Canada. I actually didn't know that before today. That's amazing. I'm so excited to get the chance to talk to you.
Oh, thanks. Thanks so much for inviting me. I'm quite excited to share any information. Love derm and just love to help anybody as much as we can.
Well, I've said this a lot on the podcast, and I still a little bit maintain it in my head where living in Florida, I will take any and all information about derm. And I have been told through so many different recordings of, webinars and podcasts and things like that, that Florida does not have the monopoly on dermatology. I still don't know if I'm convinced, I'll be honest, but living in the Southeast, I certainly will take any and all information about how to treat derm conditions.
Yeah, I think you are in the hotbed, would be my opinion. I'm way up here in Ontario, Canada, where we have 4 seasons. So a lot of our allergy guys get relief over the winter, where your patients don't have that luxury, right?
Jenny, I feel so seen.
Good.
Yes, there's like no breaks, no breaks. Well, and we do get a little bit here in North Florida, but not like other places. And so, certainly that creates its own set of challenges because then, if we are having to use antibiotics frequently and our patients aren't getting a break and things like that, it can, we can run into a problem really quickly. So today we're going to talk about therapy, kind of outside of antimicrobials, which is another big area of interest for me as well, for all the reasons we just talked about. So fluorescent light therapy, can you tell us more about fluorescent light therapy?
Yeah, so it's photobiomodulation via fluorescent light energy. So, light therapy is not new. I actually did some quick Googling this morning. And wouldn't you know, like 2,500 years ago, Socrates, the father of modern medicine, was using light therapy. Obviously, not fluorescent light therapy, but we've been trying to harness the energy of light and its healing properties for a couple thousand years. So, fluorescent light energy is fairly new. We started that after the fluorescent light bulbs were invented back in 1920, 1930. And since then, we've been trying to figure out how to use it. And it's got quite a long track record in human medicine because it stimulates regeneration of the skin. So us vain humans, as soon as we hear something like that, we're like, ooh, how can we get rid of all these wrinkles that we don't want anybody to see?
Absolutely.
Yeah, I'm on board too. And now it's funny because the red light. So when you use the fovea unit, that's the trade name for the unit that's available at the moment. But when you're using fluorescent light energy, the lamp emits a blue light, and then you use a chromophore gel on the skin, kind of to act like a prism to break it up into polychromatics. You get different colors of light coming through, and those different colors reach different depths in the skin. And the red light actually reaches the deepest, which gets down to our deep dermis and hypodermis, where our collagen is produced. So now everywhere I look, I'm seeing, these red light masks that
Oh,
you can
yeah.
wear to get rid of all of these wrinkles. I'm like, oh, okay, I see you. I get it. Yeah. So
Very
fluorescent,
cool.
it is very cool. And the way the light energy works is it gets into the individual cells and it stimulates the mitochondria. I don't know if you remember way back to grade 8 when you had to
Oh,
make a
yeah.
cell and the
The powerhouse
mitochondria.
of the cell.
Exactly, exactly. So it stimulates the mitochondria to promote a whole bunch of wonderful things that we want. So we have increased fibroblast activity, so increased healing of wounds. We have decreased inflammation because we have increased circulation. It's antimicrobial. So the blue light actually has an antimicrobial effect. It punches hole into the cell walls of bacteria, but it also makes them more susceptible to antibiotics. So, as a result, like the real magic is we have increased healing time. It's more than twice as fast as normal healing when you're just on antibiotics alone. And there's a couple of cool studies that I was reading early this morning too, trying to prep. And one study showed that they didn't describe what the wound or the skin infection was, but it took 15 weeks on antibiotics only for
Wow.
that to resolve. And that's a lot of money. That's a lot of emotional currency for an owner if they're giving meds twice a day, depending on the size of the creature as well. That can be quite costly. Think Great Dane with some chin infection, so that's quite significant amount of time. And then they had animals on the fluorescent light energy twice a week, plus the antibiotics. Those guys did the best. Their time to resolution was 4.3 weeks.
Oh
That's
my
crazy
gosh.
versus the antibiotics that we usually go down the road with 15 weeks. Like that's by far more than half the time. So that's crazy. And then they also included two other groups where they had fluorescent light energy once a week with antibiotics on board. Those guys took 5.4 weeks for resolution, so a week longer. And then they had another group. The last group was fluorescent light energy twice weekly, no antibiotics. And those guys took 5.5 weeks. So
Wow.
nearly the same as when antibiotics were on board at that twice weekly, or sorry, at the once weekly with the antibiotics. It's so game changing. Every practitioner needs to have at least one unit. And actually, when you get a unit, you're going to be like, oh, I need way more than one unit in my clinic because you'll end up using it for everything. It's truly a game changer. It is magical for our antimicrobial stewardship. I did a talk a little while ago on antimicrobial stewardship and the World Health Organization, the guys who predicted the COVID
Oh,
infection
yeah.
that took over the world. They're predicting by 2050, so that's 25 years from now, more than 10 million people a year will be dying due to bacterial resistant infections. So the time is now.
The time
This
is now. Yeah, now is when we get to change that trajectory.
Exactly. And this is one way we can do it. It's amazing.
Well, and with what we're learning now about the effects of antimicrobials on the GI microbiome and our overall immune health, I mean, I think it's demonstrated really clearly in that study where, like you said, twice a week with no antimicrobials was the same as once a week with antimicrobials. It sounds like there's a huge opportunity there to really reduce our use. And I mean, to me, that just says like kind of helping the body do what it's primed to do. And of course, antimicrobials help that too because we're getting rid of the infectious organisms so the body can heal. But if we can do this in a way that is consistent with good antimicrobial stewardship and of course we're having global benefits like what you're talking about, but even for that animal itself of while we're still learning about what's going on with the microbiome in these cases, like 15 weeks, my gosh, I can't imagine what the long-term effects of that kind of therapy would be. It sounds like there's just huge benefits all around. Like I'm not hearing a downside, essentially. Maybe cost and time, but like you mentioned, antimicrobials in the long term also carries a lot of cost and a lot of implications there. And then I wanted to go back and make sure I heard you correctly with everything because it sounds like there's big benefits here with fluorescent light. So it's emitting a blue fluorescent light, which, like you mentioned, is antimicrobial. But we have this gel that's giving us a spectrum of color, so we can get that red light to stimulate the mitochondria, to stimulate collagen. We're not having to choose between red and blue light. We're getting both, and we're using fluorescent light, so the concerns for ocular damage and things like that kind of go away with all of this. It sounds like it's just a win in so many ways.
It is. And it just out of extreme precaution, anybody who's involved with the procedure has these orange goggles they wear,
Sure.
but we don't even worry about the patient's eyes. I mean, we don't even have goggles for them because it is so safe. But there's actually more colors when it is refracted. We get blue light, and each color goes to a different depth. Okay, so the blue light is the most shallow one. So it tackles the epidermis, so the surface where we have that bacterial infection going on. It's antimicrobial. It also takes down inflammation in the epidermis. So already we're giving that patient some comfort, taking away some of that inflammation. Next up is our green light. It's also the epidermis where it stimulates our fibroblasts just under that epidermis, actually, in the top of the dermis. It stimulates healing, regeneration. Then we have our yellow/orange light, a little bit deeper as well. So, right down to the dermis, where it stimulates circulation, decreases inflammation. And then that red that we said goes the deepest, all the way down to the dermis and the hypodermis, where we really stimulate collagen. And there's actually different types of collagen. So, collagen is involved in the scarring process as well. But the type of collagen that it fosters is the one where we get minimal scarring. So, that's a bonus if you have a big, ugly wound that you're working on. that's just a bonus. But if it's over a flexure surface, we're not talking about cosmetic benefits. We're talking about range of motion benefits as well. So super great.
I was kind of wondering where, I know about the red and the blue, and I figured if this was acting like a prism, that there were probably more colors, and I wasn't sure if we knew what those other colors did. But I mean, it sounds like we're learning more about that too. So getting the whole spectrum, it's just so cool to think, something like fluorescent light can do so much.
Yeah. And it's basically idiot proof too.
I
So
love
it's
that. That's what I
me
need in my
too.
life.
Me too. Me too. So you spread your gel on, and then there's like a cone around the edge of the lamp. And basically, you get that cone as close as you possibly can to the skin. Push the button. It starts a 2-minute cycle. And then when it's done, it beeps and the light goes off, and you're done.
Oh my
It's,
goodness. It is
it's
idiot proof. That's
it
that's my
is.
kind of tool.
Mine too. And it's only 2 minutes. So it's super fast. The animals don't mind it. And keep in mind, I'm in derm referral. So I am seeing the worst of the worst, right? They take months to get in to see us. And they've already been struggling for months before they get the referral to us. So yeah, we're seeing great response to the worst of the worst. But if GPs were using this, you nip things in the bud, it's going to be magic, honestly. And if you're even using it, after every surgery performed, if you have to keep an animal in a cone for 2 weeks, that is not a lot of fun,
No.
right? So if you can make that maybe down to a week or less, hallelujah, that'd be fabulous.
So I'm glad that you bring that up because that's kind of where my brain was going, thinking about certainly surgery cases. Yes, let's get rid of the cone as quickly as possible. But also thinking from a referral standpoint and you seeing, like you said, the worst of the worst. What kind of cases are you using fovea for? And my main question centers around I'm picturing like a generalized dermatitis, pyoderma, inflammatory condition. Can you treat, these big areas or, if you have an entire dog that is inflamed and infected?
Yeah, that's not so appropriate. It would be kind of like your radiographs. We used to call it a catograph, where you would
Right.
zap a picture of the whole cat, or if you had a small animal. But
Oh
it's the
yeah, I
same
used to.
thing.
I don't do that
And
anymore, I
no,
swear.
yeah, really, we don't. Back in the day, way, way back. But it's kind of restricted by size. So you have a little pot of gel, and it's basically how far that gel will spread. We need a 2 millimeter thickness. It's kind of restricted by the size of the lamp as well. I don't have my specs with me, but I think in that article, I think I actually talked about the size that was covered. We do equine patients as well. So we'll often have two lamps going at the same
Oh,
time
sure.
if it's a larger area. Because again, it's fast, it's idiot proof, and it's super, super easy. The animals don't mind it. This is something you can do even with an owner helping restrain. I put that in quotes because they don't really require restraints. You just stay still for me now for 2 whole minutes. That'd be fabulous.
Sure. Yeah. Well, and I'm sure I would imagine like the dogs love it too. They're like, oh yes, I'll just lay here and get pet and get loved on. And really when I'm thinking about it, I can't think of too many cases where I'm like, this is an entire dog that is having a problem. A lot of like skin folds and ventrum and like you said, chin and things like that.
Yeah, it's perfect for those. And again, in general practice, that's where you can train your owners. Oh, something's smoldering. Let's get them in. Because
Sure.
in derm, we're talking about frequent flyers, right? I imagine Florida must
Oh
be,
yeah.
oh my gosh, you must know your patients so well.
We do get to know each other pretty well over time. And you're right. And owners do start to recognize the signs and formulate that proactive plan to say this is the time of year you need to be on the lookout. This is what the signs look like and when we need to intervene. Here's what you can do at home. Here's where you need to pull the pin and come see me. So you're right. Owners become a huge part of the team when we're talking about derm cases. What other conditions can you treat with fluorescent light therapy?
My gosh, everything.
I love it.
Basically everything. The only thing we wouldn't reach for it is if we have something that we think or know is neoplastic. So making that even more prolific with generating things is not a great plan. And anything that's photosensitive or photoaggravated. So discoid lupus erythematosus, they've got that nose affected, the nasal planum there. Do not use that. That is photoaggravated, and often light is a trigger for that disease. Same thing with dermatomyositis, those collies that get the lesions on their face and muzzle. One of the pemphigus guys, pemphigus erythematosus, it's not as common as pemphigus foliaceus, but still. So anything that's photoaggravated, no. And that includes medications. So any
Sure.
photosensitizing medications, always keep that in the back of your mind too. It's just not appropriate use. Everything else is up for grabs. If you have a deep pyoderma, obviously you're going to need systemic antibiotics. But those studies showed it can dramatically reduce the length of time and the amount of antibiotics you need. So it's a great adjunctive therapy. If we can get down to 5 weeks versus 15 weeks, why on earth wouldn't we do that? Superficial pyodermas, hot spots, surface pyodermas, again, intertrigo, all those skin folds, any surgery, if you're talking about horses, scratches, getting rid of that proud flesh in horses can be a real problem. And this can help normalize the regenerative process with proud flesh. So you name it, you can use it. I swear it's magic. And I'm so happy to see such a game changer.
I'm picturing with the proud flesh that we see in horses. It's been a minute since I've treated horses. Are you talking about removing the proud flesh and then using the fluorescent light therapy afterwards to help that tissue heal normally?
Yeah, that's definitely one way to use it. It's also like preventing it. So,
Okay.
again, if you jump on those wounds right away and you're stimulating normal regenesis, because proud flesh is an abnormal regenerative condition. So, if we can normalize that, we can avoid that. And, the horse people know what a hassle proud flesh is.
Oh
So,
gosh, it's so bloody.
it's a mess. Yeah.
Yeah. And well, at least when you try to remove it and do all that. So yes, I love the idea of not having it there in the first place.
Yeah. Yeah.
What about the financial considerations of bringing fluorescent light therapy into practice? I imagine there's an initial investment of bringing this system in. And then, like you mentioned, we have these pots of the chromophore gel that we're using. How do you see that working just in the business side of the practice?
It That's another super attractive thing. This is very cheap. Buying the unit, I checked this morning in Canada, is $1,300.
Oh
Like,
gosh, that's like of the things that we buy. Oh my goodness, that's
I
not
know.
expensive.
No, some medications are more expensive.
They are.
Yeah, it's crazy. So the actual unit is very affordable. The pots of the chromophore gel work out to being about $30 a jar. So whatever your markup is, and we tend to do, because we're referral, we have people traveling, we tend to do 2 treatments back to back once a week. And again, we're seeing the worst of the worst. So often we're doing that for 4 weeks. But again, in general practice, if you're nipping that in the bud, maybe you only need 1 or 2 treatments and that's it. So cost is whatever your clinic comes up with. The treatment is literally 2 minutes. So for our Fovea appointments, they're technician driven. We know Spunky is coming in. We're ready for him. We have our room set up. Everything's good to go. By the time we get him in, do the treatment, and remember, we're doing back to back treatments, and get him back out the door again, it's maybe 15 minutes.
Wow, that's really convenient for owners too, because that can be one of the challenges when we have owners coming in for repeat treatments is, I don't have an extra hour or two a day to come and do these things. But if you can say we can get you in and out in 15 minutes, especially in GP where our patients oftentimes aren't traveling as far, that might be something to say, well, can you go to work half an hour late on these days for a week or so and just come in first thing in the morning. We'll get you out so you can get your dog home and get to work on time in the morning or in the in the evening. Gosh, there's always those appointments that are after 5 o'clock. You're like, oh gosh, what is this going to do to the rest of the day? Are we going to be here till 8 o'clock tonight? But it sounds like you could really have owners bring their pets in after work and you're not dreading like, oh gosh, now this is going to turn into something else and go on and on and on.
Right. It's specifically for the treatment. We have a technician leading the appointment. Sometimes we have an animal care attendant help restrain whatever restraint is for this.
Sure.
And you can if you want, you have the owners present too. So there's no mystery of what's going on in the back
Yeah,
room. It's very quick. And the other bonus to those appointments is we get to see the patient. So we actually get to see the progress with our own eyes. It's also removing any issues with owner compliance,
sure.
which is a huge bonus. And again, when we're talking about derm patients and we're talking about treatments, it's always multimodal with those guys. And that takes a big emotional toll. And sometimes it actually will harm that human animal bond that they have going on too, especially with cats. It seems, the cat sees me and it runs for under the bed. It wants nothing to do with me anymore. So, this is a bonus. We're the bad guys for 15 minutes. And I don't know. I don't see any downside any which way you look at it.
Absolutely. I love that you bring up cats because that is something that always kind of hurts my heart if I have an owner say, oh, my cat's running from me because they do, especially with oral medications and things like that. So it sounds like what you're saying is there's some really good applications here for cats as well.
Yeah, absolutely. Thankfully, we don't see skin infections in cats as often. It's more
Sure.
allergy driven, right? But, yeah, you can use it in cats. Right now, we use it in dogs, horses, and cats, but everybody has skin. I think it's just going to come down to who has the thickest skin, who has the thinnest skin. Cats have very thin skin. They're about maybe 3 cell layers thick. Dogs are maybe 5. Humans are like up to 15. So humans
Oh,
have
wow.
way thicker skin. So if you're looking at doing that red light therapy for your unsightly wrinkles, the exposure time in people is like 10 to 15 minutes, where in our animals, we're talking about 2 minutes. So
Okay.
there's a difference there for the thickness of the skin.
Does it change with cats too, with them having the thinner skin?
No, with cats, we seem to be getting away with it.
And can you still do the back to back in cats?
Yep.
Very cool. So I have one patient who I have battled with lick granulomas for her. And with what we were talking about earlier with proud flesh, she's one that comes to mind that, I mean, obviously it's not proud flesh, but it is a granuloma. It is granulation tissue. We really struggle to get her to leave that alone and let it heal. And, of course, like, as soon as we start to see it heal up, she'll irritate it again. Sounds like she might be a candidate for something like this.
Yeah, that is a perfect use. And in a perfect world, we're getting her when she just starts to fixate, right? The sooner the better, because those lick granulomas are actually a deep pyoderma. Every time they lick, they're taking off a layer of cells and they're laying down more bacteria. So it just gets deeper and deeper, which is where the thickening or the granulation comes from. And, it's going to reach deep enough. It's going to get down to that deep dermis, that hypodermis, that subcu, where again, hopefully we're fostering normal healing quicker, faster, no antibiotics. That would be lovely.
Yeah, absolutely. Because like you mentioned, with these deep pyodermas that can really get down there, sometimes we are talking prolonged therapy. So, and then it takes you mentioned the human animal bond earlier. It takes a lot of work on the owner's part, I think, sometimes to help keep these gone, and they have to be really on top of it and monitoring these animals really closely, which depending on what they have going on in their lives isn't always possible. So to say, okay, well, I need you to stay on this and let me know when it's happening, but then we can significantly shorten the treatment time, I think could be a huge benefit.
Absolutely massive. Something popped into my brain there. Oh, yeah, yeah. So for the lick granulomas, you're right, extended periods of antibiotics. So in those guys, it's not uncommon to do 8 weeks, 12 weeks. That's like 3 months of systemic antibiotics. And you're knocking out all that microflora. Like every animal, every human has about 90 trillion microorganisms on their skin. And then the gut has about 100 trillion. And we're just cluing into the fact that the bacteria in the gut run everything. So our health actually depends on that gut flora. And because we have this crazy liquid granuloma, we're damaging that gut flora for months. It's crazy. If we can change that, let's do that.
I couldn't agree more. We're learning more and more that the microflora is running everything, and we're starting to see the effects of antimicrobials. One of the most fascinating areas for me is the impact of antibiotics and kidney disease in cats and how all of that plays together. I can't wait to see where all of that research is going to go. But what I don't think we've necessarily learned yet, and I think what remains to be seen is because it's certainly antimicrobials are necessary in cases. It's not like we can say, oh, well, these, do damage, so stay away from them altogether. We need them. But we haven't really learned what the process of regenerating that microflora looks like. So when we do these prolonged courses of antibiotics, and this is my non-expert opinion on this, I'm going, okay, well, we know it's going to alter the microflora. We're starting to learn about what the long-term effects of that look like, but we don't really know, what's happening when we bring it back, or is that happening on its own? Are we altered forever? At least I don't know. Like I said, my non-expert opinion. So any type of therapy, especially when we're talking about dermatology, that can really limit the amount of time and the number of antimicrobials we have to use, I think just obviously it provides an immediate benefit, like we talked about, relief from the condition, the human animal bond, things like that. But, the long-term effects on the health of that animal, I think could be really substantial.
Yeah, and actually, speaking of long-term effects, they're at the end of one of the studies I was reading, they checked a year out on what the cells were doing. The mitochondria were still stimulated a year out. So that's the
Wow.
last time they checked. I don't know how long we actually see a prolonged effect because they stopped checking after a year. Could be forever.
Wow.
I don't know. That would be awesome.
Oh man, and that opens up a whole host of other questions. Like I can't wait to see where this research goes.
Yeah, me too.
Very cool. Very cool. So I guess, I feel like you've done such a great job of just explaining the physiology of fluorescent light therapy and what it's doing in the body and the massive number of benefits that this type of therapy can have. What do you see as the future for fluorescent light therapy in general practice, in dermatology, heck, other conditions?
Yeah, I suspect that down the road, derm referral won't be seeing a lot of these things because I think it's such a game changer that every GP is going to have like 6 units and maybe they all have to change the scheduling so that they have a constant little, I don't know, assembly line where they get those fovea cases in and get them out. Again, in Florida, are you kidding me?
Oh
Like
my
you
gosh.
you already have a plan now. I
Yes.
need 6 units and 3 techs just dedicated to this. Like, seriously, it's going to become mainstream. To me, I kind of think of it like using immunotherapy in oncology. Like, it's a game changer. We're going to look back and say, we used to use systemic antimicrobials for like months. Are you kidding? That's how that's how I see the future. It's such a game changer.
That sounds too good to be true. Like, I would love a future where we look back and go, oh my gosh, I would never reach for systemic antibiotics for this. This is something that we have so many other options and ways to manage it. And we can hopefully change that very scary trajectory that WHO has put out there, the World Health Organization has put out there. And yeah, like, I think you make a really good point that the time is now to do that.
And it's affordable. What's stopping people? I don't get it. I think just not knowing about it is what's stopping people. And I was speaking at another conference, actually, the North American Veterinary Dermatology Forum, and I actually had someone come up to me and say, "Sorry, what is fovea?" Like, this is a derm conference, and someone there didn't know about it. So
Oh, wow.
Yeah, I'm surprised that people still are just learning about it because it is a game changer.
Sure, sure. And hopefully the door is open to continue to get the word out because we are seeing therapies like laser, therapeutic laser, or blue light for antimicrobial becoming a little bit more common. So hopefully that door is open and now we can say, here's another application and we're getting this whole spectrum. And my wheels are turning as you're explaining it from a business perspective too. Like you said, it's not a major investment on the front end. It really gives our team members kind of their cases that they can manage. And I always love things that can empower the entire veterinary team, and I think that really has the potential to do it. I see the revenue stream. I'm even thinking, as a house call practitioner, I'm like, oh my gosh, you just put somebody to, put a two-person team and go around and do all these phobia treatments. Owners, we talk about, owner loyalty and affection for the practice. I think that could be a big thing. I see so many benefits from a business perspective, an animal health perspective, and then ultimately a human health perspective.
Exactly, that one health. Yeah, we're all in this together.
Absolutely. Well, I know that's not what you were here to do, but you sold me on the benefits for sure.
Good, good.
Yeah. Well, Jenny, thank you so much for joining me. This has been such a great talk. I love all the science around fluorescent light therapy. I think it's really exciting. So I can't thank you enough for taking time out of your schedule to join me. Are there any final thoughts you want to share?
Just go get your unit and then you'll need another one and maybe a third one. Seriously.
Well, I want to say a big thank you to Jenny for joining us. I'm so glad that we were able to connect. What a great conversation. A big thank you to everyone out there for tuning in. I hope you learned a lot with this conversation too. I know I did. If you enjoyed this conversation, please leave us a 5-star review wherever you get your podcast to help you and other veterinary professionals out there find this and other great content we try to put out there. If you'd like to hear more, you can click on the education tab on the VetFolio website or find us wherever you get your podcasts. Of course, we'd love to hear your input on this talk as well as ideas for topics you'd like to hear from us in the future. So feel free, reach out to me at dvm@vetfolio.com, or we can connect on Facebook at Dr. Cassie DVM or on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.